Ready?
Go.
Okay. So next we're going to do sterile field and sterile gloving. So we're going to set up a sterile field. So it says perform hand hygiene. Okay. Check the the package, the sterile drape. Make sure it's dry and unopened. Also, there's an expiration date on these. So make sure that they're not expired because they do have a date of expiration. Making sure it's valid. Select a workspace that's at waist level. So if you have a bedside, you would put that up. Open the outer cover, continue to hold the corners. Okay, so what you want to do is you would open, so I'm a medium. You always bring in extra gloves because if you don't, that's when you need it. So what I like to do is I'll open it up and I leave the packaging as my trash. And remember, we've already done hand hygiene. Now it's gonna come like this, okay? This is the back that's gonna sit on the table. So you don't have to worry about contamination. Then what you're gonna do, so it comes like this, you fold it, then you unfold it, it opens like this. Okay, so you can see your left and your right hand, okay? Now, these borders here, we can touch those borders. So, let's open. And what I like to do is really make sure that I open up, again, you can touch these borders, this 2-inch border. And make sure you open up your field so that the paper isn't caving back in on itself, okay? Now, I am a lefty, so I'm going to put on my left first. Now with this, you're gonna see a cuff here. See this cuff right here, right here? This is the inside of the glove, so I can touch that. So you grab the cuff, holding the cuff, you put it on. And then you just release. Now obviously that's not done yet, but I don't have to worry about that. So this is my dominant hand has already put on its sterile glove. Now this sterile glove can touch this whole sterile area, okay? So what I'm gonna do is I'm gonna put my fingers into, and you can touch this piece. You're going to do this. So I put it into the glove, and then I slide, and you always put your thumb out because you don't want your thumb to get contaminated. And then you adjust and see how I still have my fingers in. Now I let go. Now everything's sterile. If I want to fix this little cuff, I can touch the sterile field. So then that's all set, okay? Now this is still sterile. So if I wanted to take my sterile material, I can put it in here. This is dirty, so I would put, if I'm doing a dressing, I can put my trash here. This is sterile. Sterile hands to sterile. Now I can touch all of this. And I would make a new area. Again, sterile, okay? The borders are gonna be not sterile, the center is, okay? When I'm done, I take everything up, maybe my dressing, whatever material, put it into one hand, and enclose it into, and then enclose it. And now everything is encapsulated in that, and we can throw it away. Okay, so that is your sterile field, sterile gloving.